Okay, cool. So we're going to do some of the Boney palpations for our hip and thigh region. So what we've done is we've already introduced this to the students by showing them to locate the anterior superior iliac spine. So this are the ASISs right here. And then just below that, these are actually hard to get to, but we're trying to also get our students to be able to find the AIISs, which are the anterior inferior iliac spine. Because the rectus femoris muscles attach here, and then up top here at the ASISs, the sartorius muscle attaches here. And then we look at the whole entire iliac crest, okay? And where the iliac crest, as it goes from front to back, the ASIS, it then, and I'm going to go ahead and do it on this one and roll our skeleton model over here. So we go from the ASIS all the way to the PSIS, okay? So we're trying to get our kids to be able to find those because the abdominal muscles then attach onto our iliac crest, right? And since we have the skeleton in this position here, we're going to look at then, let's go ahead and make note of this one here. This area is called the ischial tuberosity, and it's where our hamstring tendons attach. So all three hamstring tendons attached there. That's also that area where we have that ischial bursitis, or bench warmers bursitis, okay? And then the last one here, since we're kind of using this, we want to go ahead and use and show the greater trochanter. So that's on the femur bone, and it's very easy to find because it's very prominent, very superficial. So I'm going to go ahead and roll my skeleton back here, and then if we kind of come up over here over the top and look, it's a very prominent, easy area to find. That greater trochanter, we have the bursa there, that greater or trochanteric bursitis. Okay, so what we're going to do now is try to convert this then to our human, and realize that when you've got skin and muscle and other tissue in the way, it's a little bit harder to find things. Okay, so we're going from here, then we're going to go over here to our model. I'm going to go ahead and set that down, and so and just like right here, pan. So you're looking for those ASISs. They're easy to find, very prominent. To get into that anterior inferior iliac spine, so we're on the ASISs right here. If we were to go a little bit deeper, we're going to kind of feel tendon, and we actually have to push in. And a way to actually kind of know if you're really on your rectus is kind of get the athlete to contract their quads. They can actually kind of start to do like a kind of extend their leg like this, and then contract your quads, try to keep that leg straight. Then you'll know if you're like on that tendon. Yeah, sorry about that. And some of this is a little ticklish at times too, okay? So there you go, let's do that right there. So, and then if we're like on that ASIS, we can actually kind of use our fingers and kind of feel the athlete's iliac crest, okay? What we could do is actually have the athlete lay over on their side, and then, and then keep your knees bent like you're doing like that. There you go. And then, so if we did that, then we're kind of like, you could feel like, so my fingers here, over here, it's on the ASIS, and you can actually just feel the iliac crest until it goes all the way back to the PSIS. And I'm not going to go ahead and, go down further here, but I kind of jokingly call these areas, like if you're looking in the mirror on yourself and you see what I call the butt dimples and all that, so the dimpling, that's really your PSIS. And it just kind of gives us an anatomical landmark, because just more kind of medial to that, where your sacrum kind of joins your pelvis, that's where we have the infamous SI joint or sacral iliac joint. And sometimes there's issues with that as well, okay, right? So going back to, and then since we do have our athlete in this position, we can actually then just like feel for the greater trochanter. Very easy, I know, my athlete feels that. So, and I have told my students too, if you are standing straight here, kind of like here, right here, standing straight like this, or here, I'll come out here like this. And if you just let your arms kind of like drop to your side like this, usually this part of your hand is going to be hitting your greater trochanters. They're very easy to find, okay? And then your like the ischial tuberosity, I kind of tell my students where the easiest way to kind of find this, obviously I want them to do it on themselves and all that. So if they were sitting upright, where if they were sitting upright and actually on the edge of like the bench like this or table, and their foot's down like that, those ischial tuberosities right there, you're going to be jamming right into the edge of the table, and it's kind of an uncomfortable feeling. But it's very easy to find, okay? All right, so those, again, those ischial tuberosities, where we have then our origins of our hamstrings, and then also we've got some bursitis issues there with that ischial bursitis. All right, let's see. I think we pretty much covered all of the bony stuff that we needed to on our stuff. Let's have go ahead and sit on up real quick. Okay. And I think so we've gone over the ASISs, the AIIS, or iliac crest, PSISs, greater trochanter, and then like, why don't you do that? Why don't you sit on the edge of the table, kind of show so just sit like this. So if they're sitting like that, they probably should feel like they're right on bone. And again, I mean, I know my athletes saying that, oh yeah, I can feel that. And if you were to just like activate your hamstrings a little bit, like you're sitting there, and then take one leg up and just kind of like slightly kind of like flex it, you'll feel that. You'll feel your hamstring tendons like right underneath what I call like the butt fold, where the round part of your rear end kind of connects to your leg. Okay. All right. Well, hey, happy hunting, I guess, and all that. All right.